Hi everybody, my name is Dr. John Austin and I'm here to talk to you about organizational behavior management, also known as OBM. My background is in behavior analysis. I spent time at Florida State. Sounds like I spent time in Folsom County. It was really good at Florida State. And I worked with John Bailey there in grad school, got my PhD in behavior analysis, and then I spent 15 years at Western Michigan University teaching behavior analysis and OBM, applied behavior analysis, and a variety of courses there. After that, I spent some time, I left Western, and so for the past 8 to 10 years, I've been working on my own business project called Reaching Results, where my purpose is to help leaders create safer and more effective work environments. So today we're going to talk about OBM. We're going to go through a little bit of the history, what is OBM, and we'll cover a few key studies and I'll offer some resources for you to be able to look up if you'd like to learn more about it. So OBM really is the application of applied behavior analysis principles to organizational problems and challenges, whatever those might be. And it's been applied very widely over the years, and I'll try to demonstrate that during the talk. But in general, really here, we're talking about creating better work environments that help people reach their potential and improve business results. In practice, this is typically done through engaging leaders and coworkers to create a motivating environment. It's all about, I think if we were to talk generally about what OBM takes from applied behavior analysis and behavioral thinking, it's that environments drive behavior. And so what we're talking about doing is creating environments that drive the kinds of behavior that the workers want and that the leaders want in the organization, that the organization needs. OBM scientists study the effects of these same tools in the field and lab settings using experimental research. And I'll point out later in a little bit more detail that that's part of what sets OBM apart from other pursuits in organizational psychology. Yeah. So like the behavioral elements lead to lots of experimental research as opposed to correlational research and stuff. The field is very pragmatic, and it's more pragmatic than theoretical, meaning the whole purpose of the field really began as writing down tools and techniques and in a usable format for leaders. So what do we know about behavior and how can leaders use it, really is what the field is about. So there's a science of OBM and there's a practice of OBM, and there really always has been. I think the practice really started first, and then the science kind of caught up with it, adding a journal and academic programs and stuff like that. But in practice, what OBM consultants or practitioners teach leaders are things like observing behavior. And this sounds very simple, but in the mainstream, that's not usually what's taught in leadership, right? If you pick up a standard leadership book, text, or a book from the popular press, if it's not really based in behavioral science firmly, it will not refer to behaviors. It'll be more likely to refer to personality and traits and things that are really difficult to observe and measure and stuff. So like one of the real strengths here and the most powerful features of OBM and its practice is to teach leaders how to observe what people say and do really carefully. And that has great power because it allows you to make decisions based on data as opposed to opinion. We also teach leaders to understand the causes of work problems and remove barriers. It's not uncommon for me to encounter a leader who has an employee who's not doing what the leader wants them to do or what their expectations are for the job, and so wants to fire the person before they really understand what it is that's driving the person's behavior, right? So it could be Well, there's one story that's from a client that, that illustrates this, where they had a series of contractors who were coming onto site, and what they wanted them to do was to sign in when they got to the site, and they needed to use this computer system to sign in. And they found that none of the contractors were signing in. And so they were like, these guys are lazy, right? And that was the kind of typical thought there. And then, so, you know, as part of the course that I was teaching them, you know, this understanding the causes came up, and it's like, well, okay, so why don't you go collect some data? Well, I have. None of them sign in. Okay. Have you asked any of them why they haven't signed in? Okay, I'll do that. So they go and they come back and they're like, yeah, they don't have a password. So, you know, I mean, that's just how many of these problems end up. The solutions are not mammoth. You know, the solutions are typically very simple, but it requires some effort and some understanding of behavior in order to get to them. So understanding the causes of work problems is a big part of what we do. And, you know, just like applied behavior analysis, the term analysis is in there for a reason. It's not merely applying solutions that we think might work, it's understanding the situation and then applying the appropriate solution. So we also teach education and training. We teach people and supervisors and leaders, managers to agree with their staff on expectations. And actually this is, you know, broadly studied. There's some Harvard Business Review articles that came out recently that said in the last 50 years, this is one of the things that leaders have the most trouble with, is something as simple as agreeing on expectations and making them behavioral. Giving feedback, receiving feedback, using incentives, reinforcement, praise, and adding that. There are people in the field like Aubrey Daniels and Associates who are, you know, famous for pointing out since the early 70s that work environments are devoid of positive reinforcement, by and large. Many work environments are run on punishment and coercion and stuff like that. And so, you know, Aubrey Daniels and his team have tirelessly taught people for 40 years how to deliver reinforcement and praise and to use that. And it's a magnificent tool. And the research bears it out as well. So compared to other management and leadership approaches, OBM is behavioral, experimental, and evidence-based. It operates under the 7 principles of applied behavior analysis as well, according to Bearwolf and Risley, 1968. So it's firmly a part of applied behavior analysis. So I want to talk a little bit about where it came from and what the guiding scientific models are here in OBM. The primary guiding model is the ABC model, which shows that behavior is a function of antecedents and consequences. That is stuff that comes before it and stuff that comes after the behavior. That's really what drives any given behavior at work, at home, in other settings. Doesn't matter really what the setting is. It's just that the antecedents and consequences will change based on the situation and the environment, the context. So solutions are either antecedent-based, like I'll show a study later in this talk, building awareness, so that might be an antecedent-based solution. It's typically not as effective as consequence-based solutions, which might include like feedback and reinforcement. Or it could be both. So, you know, I've said that it's pragmatic. OBM's pragmatic, meaning that, you know, we really just want to find things that work and demonstrate that they work and help people in business to provide better results. Because at the end of the day, most people who are managers and leaders in business, they may not know anything about applied behavior analysis, and they really don't care whether it's applied behavior analysis or something else, as long as it works. Yeah, so like there's that pragmatic force, but typically the stuff that works comes from applied behavior analysis and thinking, and it can be explained in terms of, you know, behavioral thinking. So like having the model is really useful for coming up with other ideas that people might not have thought of. The field has many names, it turns out, and because OBM really was kind of the scientific name, or the name of the science as it developed. As practitioners, we use different names. In fact, when I'm doing practice work and consulting work, I don't typically use the term OBM. I'll often use the term just behavioral science or behavioral leadership or something like that. In my work in safety, it'll be behavioral safety leadership, right? And that's just because the terms typically are more acceptable to the people, the audience, right? So like the terms change, but some of them have been include performance management, which, by the way, if you Google performance management, what you'll find is an HR strategy for managing performance that really is closer to like performance review, yeah? And it's not referring to this field at all. But Aubrey Daniels International really coined the term performance management and wrote a great book on this topic, which I'll recommend later. And that's different than performance review. Organizational behavior modification, or OB-MOD, and you can understand why we don't use that term much anymore. Performance engineering, which was coined by Tom Gilbert in the 60s. Performance analysis, behavioral leadership, behavioral science in business, behavior management techniques. In fact, there are subfields in OBM focused on safety, and that's known as behavior-based safety. In fact, that's probably in manufacturing and probably construction and industry, heavy industry, BBS, or behavior-based safety, is probably the most well-known version of OBM. But we also call it behavioral safety leadership in those cases. But when it's directed at safety, this is using the same techniques and dedicating them to creating safer work environments. So some of the origins, where did this come from? I looked back at, like, in preparation for this talk, and found that really this was happening. There were organizational applications, arguably before the 50s and 60s, but people who are well known in our field were active in the late 50s and 60s, and it really mostly emanated from Harvard. And it was people like Dale Brethauer and Tom Gilbert who went to study with Skinner in various capacities and encountered Holland and Markle and Herrnstein, and Holland and Markle's work in programmed instruction really is kind of where this started. And there's another element that most people, Dale Brethauer, for example, would point to, and that is in 1959, Ione and Michael published a really very well-known study called Psychiatric Nurse as Behavior Engineer. And what they showed in that study in 1959 was in a mental health facility, there were nurses who were experimenting with, and Ione and Michael helped them experiment with, I should say, behavioral techniques to change the behavior of patients in that hospital. And so, there were a series of studies, a series of experiments in that. If you haven't taken a look at this, it's a fantastic article, just to demonstrate in a really simple way what staff can do to impact the behavior of patients in a hospital. And I think before this, it was, medication was the main option, right? And management, but it wasn't really changing behavior. And so the insight here, I think, for OBM is that you can teach staff to manage behavior. And so, like, Ione and Michael were coaches, effectively, to the psychiatric nurses. And so the data that I'm showing here are data from one of the experiments where they had, the nurses had a challenge with a patient who entered their office and disrupted things. And when they started, it was like 16 times a day, right? So it was happening often. And so Ione and Michael coached this nurse to use extinction, effectively, to ignore the patient when they came in. And so the instructions were very clear. It was like, do not make eye contact, do not speak to the patient when they walk in your office. Act as though they're not there, right? And so you can see in the data, it went from 16 down to close to near zero, right, over a matter of weeks. So highly effective. We know this now. It's kind of secondhand, right? But like, it was a great experiment demonstrating the power of coaching a staff member to behave in a certain way and then influence the people they interact with, right? So like, a lot of people see this as the first OBM study. And I'm sure that in other areas in applied behavior analysis, they also claim this study for the origins of their field. But it was 1959, and there weren't many outlets for publications of work of this sort. So that was one of the the early studies. And it came from these innovators, really, creating an environment where people could do studies like this. So specifically, I just wanted to talk about some of the early, some of the innovators in the field. And Dale Breathauer was one of them, and in preparation for the talk, I had some communications with Dale and I had the pleasure of working with him for years at Western Michigan University as well. But just more recently, I just wanted to kind of confirm some facts, And there's a great memoriam that Og Lindsley wrote about Tom Gilbert, and that put some other pieces together. And it turns out they were both at Harvard, and Tom Gilbert showed up for a postdoc with Skinner, and Skinner was like in England, and so in Lindsley's memoriam, he recounts that interaction. Like Gilbert was like, "What? He's not here? I'm getting in my car and leaving," And Lindsley was like, "No, stay, please." Because there are things that we're going to do. We're going to go to Pigeon Lab. We're going to talk to Herrnstein. We're going to work with Holland and Markle, and they're doing interesting work. And so Gilbert stayed, and then eventually trained Rumler. And so like these three guys really got together and performed the earliest applications of OBM. And then they started, or were formative, I guess, in the early stages of the National Society for Program Instruction, NSPI, which became ISPI, the International Society for Performance Improvement. Like totally not related to ABBA in any way, but these guys came from that tradition and then applied their work there. And I think each of them was president at a different time in ISPI, if I'm not mistaken. I know Breathauer and Gilbert were. And then Dale Breathauer started teaching courses in the late 60s at University of Michigan, and I can kind of confirm this with Dick Malott too, where when Dale moved to another location, he gave these courses in OBM over to Dick Malott, who started teaching them for leaders at U of M and in the early 70s. And along, kind of concordant with that in another location, Aubrey Daniels started Behavioral Systems Incorporated in 1972. And these folks really had the traditions of ABA, or the Association for Behavior Analysis, and so they came to that conference and trained people in that kind of tradition, which was really different than the tradition of ISPI. And that led to the program at Western Michigan University on OBM, which was one of the first, if not the first, that was specifically focused on OBM. There was another tradition that a lot of people don't know about, and this is the one that I learned from first, it turns out, and that's Luthans and Kreitner, and they published a book in 1975, and some articles slightly earlier than that, and their tradition really was in business and management, and so they worked out of Academy of Management. So there really were like three different academic associations involved with this development. And then from Luthans and Kreitner's work, they developed the program at University of Notre Dame, and that's where I got my undergraduate degree. And so the first book I ever read was not Aubrey Daniels, which is really the most formative text in the entire field. Instead, it was Luthans and Kreitner, OB Mod. And it's a great book still, and it's interesting how they formed kind of separately from these others, but it all links back to programmed instruction, really. So I think I've already said ISPI and OBM are really separate now, although they came from the same roots. And inside of ISPI, what you've got is human performance technology. So their equivalent to OBM is called HPT. And there are loads of people who are trained and certified in HPT now. In fact, there are 10,000 or more that go to the ISPI conference. It's a big organization. And many of them are trained and certified in HPT and don't know anything about OBM at this point. But they're using a lot of the same concepts because they're all based on Breathauer and Rumler, Gilbert, and so is OBM, but it kind of went in different directions. I think that's interesting. And many of them don't talk. And over the years in OBM, we've made efforts to try to get them to kind of come together. And Dale Breathauer was president of ISPI, and he tried to bring them together, but they just have different practices and different kind of theoretical roots in some sense. But like they all go back to program instruction. So there was that program instruction link, and I just wanted to lay out some of the assumptions in each of these to see how it kind of came together. So one of the assumptions or foundations is active student responding. Yeah, it's also a focus on designing the educational environment and how much that matters. And Sue Markle wrote a lot about this. Yeah, and then immediate feedback and reinforcement and its impact on behavior of the learner. So that was really important. Then you had behavioral systems analysis, which was Breathauer and Rumler and Gilbert really kind of coming together for that. And that really involved understanding how behavior changes through systems analysis. So one element is that systems evolve and behavior changes based on internal and external feedback loops. So again, we're back to feedback. And so OBM really kind of sprouted out of that, being the application of behavioral principles to individuals and groups at work. And the earliest studies, and even still today, the most common solutions found in OBM, science and practice, involve feedback and reinforcement. And you can see how they directly came from active student responding, from program instruction and behavioral systems analysis. So, another notable kind of early thing, and this relates to really the first very clearly obvious OBM study. And it wasn't really a study. It was a popular press article. It was like in Newsweek, I think, was one of the articles. But there were a number of articles about Ed Feeney and his work at Emory Air Freight. Yeah, and Dale Breathauer taught him as an executive at University of Michigan. So like Ed Feeney comes to University of Michigan, takes this course with Dale Breathauer, and then applies it in his job. It saves like $3 million. It catches in 1970-ish, around that time, right? And then by the early 70s, there are tons of articles about like, wait a minute, feedback and reinforcement can save you millions of dollars at work, right? And so it's just a great series of articles that you can look up that was like this groundbreaking stuff, which, you know, obviously Skinner had demonstrated since like the 30s, right? So lots of magazine articles in the early 70s on reinforcement and Skinner's theories at work. That kind of, I think, that and Ione and Michael's work really led to Aubrey Daniels teaming up with Fran Tarkenton, who was a famous football player, famous quarterback for the Minnesota Vikings. And didn't know anything about behavior. He just wanted to start a business, I think, after his football career. And so Aubrey taught him about behavior. And they put their heads together and started a business called Behavior Systems Incorporated. And that was one of the first consulting firms, for sure. So, you know, there's lots of activity around this time in business, and people are saving money and finding the utility of reinforcement and feedback at work, which, you know, if you step back and we think about it now, it's like, duh, right? Like, of course, people, you know, want to feel good about what they've accomplished, and they want feedback on their performance, and yet, feedback and reinforcement is still lacking in most work environments. Or it could be made better. It could be improved, and it could be made higher quality. And in just about every single organization that I've worked in, thousands of leaders I've taught over the last just only 10 years, every single one of them could use it, right? So like, it seems common sense, but yet it's not human nature to do it. You've got to create the right environment for it. So the science started then, and so by 1977, you know, some will say over 40 articles were published. Some will say over 100 articles were published. It kind of depends on which articles you claim to be related to OBM, but suffice it to say that there was a lot of work going on, and there was no journal, there was no dedicated journal for this work, and so so what they did was they started this journal, and it's called JOBM, Journal of Organizational Behavior Management. It was started in 1977 by Behavioral Systems Incorporated, and Aubrey Daniels was the first editor. This gave a direction and an outlet to the field so it could develop scientists, and this was a kind of a critical juncture, right? So now training programs could could direct their students' research toward a certain journal. They could read the journal and have it as part of coursework and curricula and stuff like that. And now in 2018, we're in volume 38 of JOBM. I served a term as editor for JOBM, and they're still going strong, publishing lots of great work in the field, and it's a wide variety of organizational applications. It's some of the reviews that have been conducted show that most of it consists of experimental data, and most of that data consists of field research. So like it's actual applications in actual organizations. Now there is like a growing field, a growing series of lab studies that are being conducted, and some people are conducting some translational research that takes an organizational challenge, like let's see, like delivering reinforcement or something like that, or delivering praise, brings it into the lab to study it, and then makes recommendations for the practitioners and stuff. So that's happening too. But by and large, most of the research still is applied research in organizations in field settings. So consultants in this area practice in a variety of domains. I've listed just 5 of them here, but there are probably 20 or 30, and the list is as long as business will allow, really. It just really depends on the language in which the organization speaks and the challenges and opportunities that they're facing, right? So but some of them are, broadly construed as performance improvement, leadership, training and development, safety, culture change. There are organizations like CLG that for a while focused primarily on mergers and acquisitions and merging cultures of 2 organizations, right? And so they were applying behavioral principles to help people, change their behavior to align with the behavior of the new organization's culture, right? There are other consulting firms who have focused primarily on, when there's an IT or information technology computer-based solution. The biggest source of failure often is that people don't use the system, right? So you spend like millions of dollars on a system and then no one wants to use it, and they're using Excel instead, like in secret, And so there are companies that focus on changing people's behavior, employees' behavior, so that they readily adopt new solutions, technology solutions, right? So it could be anything, really. If it involves people, then OBM practitioners have probably worked there and are probably currently working there. In the science and the research studies, the most common targets are productivity, quality improvement, customer satisfaction, safety behavior, training and education. There are many studies in each of these areas and others too. We serve a wide variety of industries. I myself have worked in every one of these industries, and as a practitioner in OBM, it's not hard to do because we really don't bring industry experience. What we bring is behavioral knowledge, and we need to partner in practice with the individuals who know the industry, who are working in that industry, to help them understand the impact of behavior and the impact of their own behavior on the business, the organization, right? So that's what we do, and we do it in aviation, construction, education, government, healthcare, human services, all these different areas. I would say that early studies and early applications were primarily targeted at manufacturing. And probably the reason was that there were very stable environments, right? And you could easily envision how changing some behavior in a manufacturing organization would improve profits or improve productivity. At Google, it's a little harder because the outputs are less tangible. Yeah. So, but believe me, they have an entire behavioral science team that's applying a lot of these concepts at Google and lots of other technology companies in Silicon Valley and around the world. So this is really widely applicable, as I said before. So the primary solutions that are used in OBM in the science, almost the vast majority of the scientific studies involve package interventions, which means putting a bunch of things together. Might be feedback, reinforcement, and task clarification, or expectation setting, or something like that. So you put a bunch of things together to solve the problem, and typically the effects are quite large. They're so large that mostly we don't use statistical analysis, we just use visual analysis. And it's here's productivity, and then we did feedback and reinforcement, and it went like that. right? And it's really obvious, everybody's happy, there's an immense behavior change, and they typically save lots of money or make more money. So some of these interventions involve, some of the techniques, I suppose I should say, involve analysis, and I want to talk a little bit about that. They might involve task clarification or expectation setting. They might involve feedback, reinforcement, praise, coaching, incentives, scorecards, any variety of these combined even, and probably other things too, certainly other things. Some of the recent work that I'm doing right now involves having supervisors have more frequent and more impactful conversations with their staff, which sounds fluffy and light, but in practice, what it means is we're talking more, and I have more opportunities to give you feedback and reinforcement, really, is what it comes down to in coaching, right? But in practice, especially in manufacturing settings, people don't really like to talk to one another. They're just like, I'm doing my job, leave me alone, right? But what we know is the more they talk to each other, the better they get along, the better the products are. And I think that happens across industry. So just a couple of examples of behavioral analysis. Probably the most frequent, widely used analysis is called ABC analysis. And this involves kind of delineating, looking at a specific behavior and then delineating the antecedents, or the things that come before it, and the consequences, or the things that come after it. And Petrock wrote an article in Journal of Organizational Behavior Management on this topic, and it's sort of like a demonstration article in the early 80s. And then Aubrey Daniels really made it popular and turned it into a bit of an acronym, which they call PICNIC analysis. And it's very easy to use. And PICNIC really just refers to the ratings of valence, timing, and likelihood. So like valence is positive or negative, that's the P. Timing is immediate or future. And likelihood is certain or uncertain. So that's PICNIC. It's spelled out really clearly in Aubrey Daniels' books on performance management, which I'll give you a citation to at the end. There's also a different model, and that's the behavior engineering model, and that I think is somewhat less popular, but is still widely used in certain areas. And it really took the ABC model and combined it with two levels, or did the ABC model at two levels, the environment level and the performer level. So if you wanted to think about this, you could take any given performance and you could ask questions in a variety of these boxes that occur from this 2x3 matrix, right? So environment, information and knowledge that's in the environment might be questions that you'd ask about information and feedback, like is the performer getting adequate information? Are they getting adequate feedback before the task? From the worker's perspective, that means do I have the right knowledge and skills? The resources and capacity in the environment might be does the person have the right resources or tools? And the worker, you look at the worker, and that means do they have the capacity to perform the job? And so as you see, you can kind of walk through, and Gilbert really wrote out some questions that you could ask too, and it's just a quick and dirty kind of informal assessment that you can conduct. And then finally, there was the Performance Diagnostic Checklist, or PDC, that we spelled out in 1999 in JOBM, that was really kind of a combination of both of the earlier two that came before it, with just a different way of asking the questions to get us a little bit closer to a true informant assessment from an ABA kind of perspective. And so we laid out questions about antecedents in the work environment. We laid out questions about equipment and process in the work environment, the skills and abilities, and the consequences that the performer might be or might not be experiencing. And that, the idea there is to answer yes or no to each of these questions, and then that directs you toward a particular solution. And we used it really successfully in a number of studies with novices in the field. So like undergraduate students who had never worked in an organization could go find a target performance in a real business and ask the right questions and come up with an effective solution and implement it and make a big improvement. And they wouldn't really have to know a lot about business or behavior, really, when it comes down to it. With some coaching, they were able to do that. And we published a bunch of studies, like 5 or 10 studies showing that in different environments. So the other solutions, task clarification, what the research has pointed to in that are specific, getting very specific, very behavioral and observable when it comes to setting expectations. So a lot of times this means like writing it down, making it a checklist, making it something that is easily observed. We also know that getting engagement from the performer produces better results. So in the modification days of the 60s, it was probably a whole lot more common for a supervisor to tell you what the expectations are and then fire you if you don't do them, right? But now, in these days, we've found that it's a whole lot more effective to have a discussion about it, gain commitment from the person, and while you're doing that, uncover any possible barriers to engaging in the performance and stuff like that. And it's just a whole lot more common sense view, but it's also bared out by the science. Feedback. Lots of studies on feedback showing massive effects in performance in lots of different industries on lots of different targets. And what we know is that the more immediate, the more behavioral the feedback is, the more effective it is. We also know that graphic, verbal, and written feedback can have positive impacts. Graphic feedback is probably the most effective to show performance over time, because it gives you something to reinforce when you see improvements. There's a good deal of research on positive versus constructive feedback, and some data showing in a variety of different fields even, showing that a ratio of high ratio of positive comments to negative or constructive comments is more effective. So like if you looked at the ratio of your own statements, you'd want to maintain a 4 positive statement to 1 constructive statement kind of ratio or better, right? That doesn't mean if you have 8 positives, you need to have 2 constructives. It could be 8 to 1, and that's actually better. Then finally, reinforcement and praise, and I kind of went through this already, I think, but those are highly focused on, highly studied, highly used techniques. There's an entire industry on coaching, which I won't get into here. Lots of varied targets, but typically it's a verbal discussion between a coach and coachee, and it involves all of the tools and techniques that I told you about earlier, like behavioral observation, some data collection, database decision making. Are there ways that you can get feedback, either verbally from your coworkers or by surveys, and things like that, and then a focus on results and like, are things improving or not? And if not, you've got to adjust your behavior and try again. So like a real focus on experimentation, a real focus on data and behavior. If you've got those 3 elements, you can make improvements in most settings. There's an entire field of incentives, people who have focused entirely on incentives, which is beyond the scope of this talk. But this is the idea that when people are paid based on the achievement of results, that drives their behavior. This is widely used in business, but not widely understood very well. And so in most of my client engagements, that's not the first thing that I recommend people going toward. Many people in the area of occupational safety, for instance, want to pay incentives for avoiding injuries, and I think that's a terrible idea. And the reason is that sometimes injuries are self-reported, yeah? And if I'm paid a few $100 to not self-report, I'm likely to not self-report, right? So you're going to get like under-reporting. So you've got to really think through what you're trying to reinforce here with incentives. But there are people in our field who know it really well, and like Alice Dickinson has done a great whole series over the years of lab studies showing the impact of various types of incentive systems. Scorecards is another field that is pretty widely acknowledged. Aubrey Daniels has got a great setup on performance matrix in his performance management book. You can look into that for more details there. Typically, it's a summary of 5 to 9 performance targets that's used for feedback purposes. It can target behaviors or results or both. It can target financial stuff. It can target just about any metric that you've got, which is, the good part about it. Again, there are many ways to do this wrong and only a few to do it right. It's kind of complicated, I think. It can drive the wrong behavior, in other words, and does a lot of times if you haven't thought it through very well. behavior-based safety, I should say something about this because it's so common, so prevalent. The typical approach that's been spelled out by Terry McSween and others, he's got a great book on this called The Values-Based Safety Process. The process involves assessing injuries in some way and sort of figuring out the behavioral and environmental determinants of the injuries, putting those things on a checklist and developing a behavioral observation process, teaching people to observe the behavior of each other, coworkers or people who report to you, and give verbal feedback and reinforcement based on like what you're seeing, right? It's lots of studies showing that this works or can work in the right environment, and not too many studies showing, that it sometimes doesn't work. And in practice, we find this because you start to find like what are the critical success factors. There are a few studies on that. Scott Geller did a really nice study on critical success factors, and what the consulting experience kind of bears out, and what the study that study kind of suggested was that poor relationships between people in those environments can really reduce effects. Because like, I'm going to walk up to you and observe your behavior, but you hate me, and I hate you too. And so how is that likely to go when I give you feedback? So there's that. And then the other thing is that people in the field sometimes misunderstand the fact that this is all self-reported data, and so they think that it's accurate. And in many cases, it's not trained to a level of accuracy. And so we actually did a series of studies that Alicia Alvaro termed the observer effect, and we published these to show that it actually still has an impact even when it's inaccurate. So the impact is, if I'm an observer and I come and observe your behavior, it actually changes my behavior when I go back to work, which is an interesting, it's kind of side effect that we didn't, I'm sure that we didn't expect in doing these. Like, I had done 50 or 60 implementations of behavior-based safety before it occurred to me that that was something that happens, So like, because we're very focused on changing the behavior of the person who's receiving the observation, not who's doing it. So, so there is that benefit, even though the data are often inaccurate. Just want to wrap up with I want to talk about a few studies in the area and a few noteworthy books in the area. These I've mentioned already, all with the exception of actively caring for people. So the first two really are focused on managing and leading, performance management, and then human competence by Thomas Gilbert. Performance management, the newest version is Aubrey Daniels and John Bailey. Aubrey has had many versions over the years. I used many of them, different ones in my courses, and it's like the go-to text when it comes to teaching a course, a basic course in OBM, performance management. Actively caring for people and the values-based safety process are things that are focused on safety. And so if you want to learn more about that, they're both excellent texts on those topics. Value-based safety process is more of like a how-to, step by step. And so it's a kind of a reference book. I have a list of like 50 books that I give out routinely when people want to learn more about this, and I've limited this to 4. I've left off some important stuff, but like this would get you a pretty good knowledge of what's out there. I wanted to end by talking about a few noteworthy studies in the area, and I wanted to start with the first study that was published in the first issue of Journal of Organizational Behavior Management, JOBM, and it was focused on industrial absenteeism. And so this was like the lead article in 1977. It involved 7,500 production workers over 4 years. And the solution really was reinforcement and feedback. It was, they called it an attendance management system, but really it was non-monetary reinforcers, like small tangible reinforcers for attendance, and progressive discipline for missed attendance. So it was really like kind of a differential reinforcement program, right? So like if you came, then you were given tangible reinforcement and praise, and if you didn't come, then you were written up, and after 5 steps, you could be terminated. And so like they had a variety of different reinforcers. One of them was you don't have to punch in if you come for a certain period of time, which the employees really liked. They also were able to earn time off if they came on time. And then finally, which I thought was, this is amusing, I think, you could like not be involved in the program if you were good enough, right? Like we're just not even gonna focus on you because you're so good. So you got immunity from the program as a reinforcer. And then the progressive discipline, like I said, could end in termination. And what they found were these massive effects of, over time that showed that, a huge reduction in absenteeism across 2 different plants. So you had a multiple baseline design across 4 years of data with 7,500 factory workers, right? So like really strong, robust kind of data over time, unlikely to be caused by anything else. Here's another one that was by Jerry Shook and colleagues when they were all in Kalamazoo at Western Michigan University. And this involved staff performance at a psychiatric hospital. And so human services staff, completely different from a manufacturing absenteeism study in industrial manufacturing. And what they wanted to do was help the staff or encourage the staff to complete graphs on time. And so part of their job was to update graphs of data collection on the persons with disabilities who they were working with, right? And so, but the staff didn't do that. And so as you see in baseline, it was 0%. And so they provided some instruction on how to do this and got a little blip. And in fact, they ran a first experiment, which I won't show you, but it basically involved giving the staff instructions and reducing response effort, which meant they basically partially completed the graphs for the staff and hung them up for them. And then the staff had to complete the graphs, right? So, so that produced an effect, but it quickly trailed off over time, right, as we'd expect it to. And so they ran experiment 2, and experiment 2 kind of did the same thing, but then they added group and individual feedback and social reinforcement. And so for the group feedback phase, they just showed the percentage of the group who had completed their graphs. So no individual accountability, really. And that worked like kind of marginally, got a marginal improvement. And then they added the percentage each individual did of current graphs on a daily basis, and you see that doubled performance or tripled performance, right? So that individual feedback made a big difference. And then they added a praise condition, or they added praise to it at the end there, where they praised for 100% performance, and they had a whole system really where they said you could become, this was the 70s, so they said you could become a cog in the machine. And COG was short for current overt grapher. So you could be a COG if you reach 80% for 5 days, and you'll get lots of praise, and your name goes on the wall and stuff like that. But one of the reasons I picked this for several reasons. One was because I loved Jerry Shook and his work. But secondly, it's an early study in staff performance using OBM, and then thirdly, it demonstrates what a lot of OBM programs do these days in practice is they create a whole system around it. And so there was like a media campaign, as it was, like hanging up posters in the 70s. Now it's like, it may be social media. They name the campaigns oftentimes. There's marketing associated with it, right? And so there are these like awareness components and motivational, inspirational components that I don't think have been well studied yet, but like are used widely and seem to be really effective, right? Just a couple more studies and then I'll wrap up. This one was in still a different setting, and this was, Chris Anderson was my first mentor in OBM at University of Notre Dame. And what they focused on was cleaning and customer service in a hotel. And so they went through a few different phases, but the most important thing is that they created a checklist with observable behaviors on it, and they taught supervisors to use the checklist to monitor cleaning in the hotel room. And so this is one of the first studies I read when I was learning about this. And I remember distinctly Chris Anderson saying, okay, so we did a lot of studies measuring cleanliness in hotels, and my advice to you is never sit on the bed cover. Which, for 25 years that stuck with me, and I never sit on the bed cover now. So Anyway, what they did was they were able to improve cleaning by measuring it and then clarifying the tasks. So they gave the individuals the checklist and helped them to understand what it was. So first, tell them what to do in really clear terms. And this was not participative in any way. It was just like, hey, this is what we want you to clean, and we've got a checklist to demonstrate it. And then we're going to give you feedback on it. So we gave you graphic feedback on the percentage of items that you cleaned as spot checked by your supervisor after you finish. And then they implemented a token economy. So when you reach certain levels, you got points, and those points were exchangeable for like items, right, that you could buy normally with money, right? And they got these massive improvements. As you see during baseline, it's super variable, and by the end condition in each case, each of the groups across this multiple baseline, it's near 100% and highly consistent, right? And you may think, well, like that's simple, right? It is in many ways, but yet you could go into virtually any hotel today and you could probably find a baseline that looks a lot like this baseline did, and you could use these same techniques to help them get to 100% because they're probably not there. It's just human nature. If they're not creating the right environment, they're not getting the behavior they want. So I'm going to skip this one and this one and end on this one. Beth Sulzer-Zaroff is one of the leading figures in behavioral safety, and she was one of the first to publish any studies on this, which I think is notable in the 70s to have had Beth Sulzer-Zaroff and another woman, Judy Komaki, who's still doing great work as well, both be the early adopters and the first to publish in these areas, which I think is pretty cool. So I wanted to pick this study in particular. Beth did many great studies, and I was fortunate to study some with her. She mentored me, and we wrote an article together as well, reviewing behavior-based safety. But what she did here was to demonstrate what I described to you earlier, this behavior-based safety process. And so what they did is, in a factory of 225 employees, they did an injury assessment. They developed checklists that were of critical behaviors. And by the way, I'm just showing you one department here. They did it across multiple departments. Each one had a different checklist because they had different hazards and risks. They developed an observation process, and then they implemented a changing criterion and multiple baseline design to evaluate the impact of giving people feedback and reinforcement for achieving on these checklists, and then setting goals for each of them as well. And so over time, you see that performance went from 70% on average up to 85% or so, and it was very systematic, and it was not punitive. It's not coercive. To my knowledge, no one was fired. They used positive reinforcement. They used feedback, and then they saved money. And interestingly, they reported in this small factory $55,000 in savings, which is around $107,000 in 2018 money, which for a single factory of 225 people is significant. I mean, like, that would show up for sure. It's not a rounding error at all. So, like, important injuries didn't go down. Injuries look like maybe they increased. And I think they'd attribute that to creating a more positive environment. Maybe more people reported injuries, but the severity of injuries went down. And the behavior clearly changed, right? So like over time, you'd expect to see more significant injury reduction and stuff there. So really cool study that's kind of, exemplary of the studies that are out, or the practice that's going on out there, and lots of the other studies in this field of behavior-based safety. So I'll end with some additional information. If you'd like more information, there is a special interest group that's part of the Association for Behavior Analysis called the OBM Network. There is the Journal of Organizational Behavior Management, which any university library has. Lots of published studies are also in the Journal of Applied Behavior Analysis. And then really kind of non-behavioral journals that also publish work in this area include Performance Improvement Quarterly, Journal of Applied Psych, Safety Science, there's Journal of Safety Research. There are a number of them out there that are friendly toward behavioral applications like ours, and publish them and have over the years. There's a fantastic history of the field that goes more in depth than I went, and in fact lists a bunch of the early articles in a really systematic way by Alice Dickinson, and that was published in 2008. Historical Roots of OBM in the Private Sector. So I'd suggest checking into these and other resources. And I really appreciate you having me here, and thanks a lot for listening.